Yeah.
Jenna's resume was too long to film. She's an amazing superstar. Here she goes.
Today what I want to present to you are the human rights violations against Lyme and relapsing fever borreliosis patients, and I'm going to detail the accounts. There are 11 international treaties in violation now regarding Lyme human rights, the human rights of Lyme patients, and all of these are now documented and on record at the United Nations. So I'm going to give you a little bit of background and the details and explain to you a little bit about what this means in terms of advocacy work. So this is a global effort, and I'm working with representatives from basically every region except for a part of Asia. In 2017, in a country known for its universal health coverage, a doctor had his license suspended for treating Lyme patients according to clinical guidelines that meet internationally accepted standards. As a result, currently, there are no known doctors in all of Sweden, not one doctor in all of Sweden, who is trained in these clinical therapies. Meanwhile, an 8-year-old Swedish boy has been losing more and more of his ability to talk since he tested positive twice for Lyme borreliosis infection in his nervous system. He was given a short course of antibiotics by his non-Lyme trained physician, and his parents were told not to worry about his increasing number of neurological signs and symptoms. By suspending the Lyme doctor's medical license, the Swedish government has created obstacles to care and all those suffering from this infection in their entire country. Colonel Nicole Malachowski had nearly 2 decades of experience as an officer, leader, and fighter pilot in the United States Air Force when she was infected with Lyme borreliosis. She is among the first group of women to fly modern military fighter planes and led a fighter squadron. She's a tough cookie. This colonel testified before U.S. federal officials in December 2017 as to how this infection nearly broke her. As her symptoms increased in range, frequency, and intensity, this intelligent woman of proven competence and bravery under life and death situations was told she could not handle stress by professionals in the military and private healthcare system. The colonel's debilitating symptoms were dismissed, and her person was discredited and trivialized. It was by luck that she found medical professionals who were competent to diagnose and treat her with protocols that included many months of antimicrobials, despite the risk of harassment and punishment for going against the previous physician's assumptions and for ultimately fulfilling their Hippocratic oath. Research in Africa has found pathogenic borreliosis infections are widespread across the continent, and West African patients who had been misdiagnosed with drug-resistant malaria subsequently were diagnosed with borreliosis infection. The medical infrastructure in Africa is less robust than that of Europe and the U.S. However, patients there who have financial resources sufficient to seek and secure their diagnosis can usually access treatment, unlike here, and these treatments are appropriate to their symptoms. As with other stubborn bacterial infections, they can pay for treatment until their symptoms are greatly reduced. The number of persons in Africa with pathogenic borreliosis infection who have resources to secure diagnosis and treatment remains unknown. Could you flip the page?
Get him, Jenna!
So I just said that in Africa we don't know how many people can get diagnosis and treatment in Africa. The numbers of persons with Lyme and relapsing fever who are able to secure diagnosis and treatment also remains unknown here in the USA.
Boo!
Late Texas Senator Chris Harris suffered for many years from a range of unexplained symptoms after his 1990 Lyme diagnosis. He was then diagnosed with late-stage systemic Lyme. During this time, the state medical authorities and medical authorities across the U.S. were attacking doctors that did not follow the restrictive Infectious Diseases Society of America clinical guidelines for Lyme. They were suspending doctors' licenses and penalizing them for spurious complaints like record-keeping concerns, or they were penalizing them with substantial fines and time-consuming, intrusive, and arbitrary tasks. Almost all of these actions were initiated by private health insurance companies, never by patients. And these private insurers complained about these doctors that were treating and got IDSA doctors as expert witnesses to deny that they were treating within their rights. The senator's doctor, under these conditions, the senator's doctor arranged for 17 physicians to take turns writing 1-month prescriptions for antibiotics to treat his systemic infection. In an interview before his death, the senator acknowledged that Lyme disease rotted out his bones and gave him a heart attack. He said, "As a Lyme disease survivor, I know how important the correct treatment can be." He was not referring to IDSA treatment guidelines. So, most people recognize that the devotion to human rights of a journalist who goes into a war zone to find and share the truth of innocent people brutalized by war crimes and by persons who organize to free children from international sex trafficking. These defenders of human rights can be easily identified because they are working to address situations we all recognize as horrific. In contrast, the healthcare system across the globe are largely recognized as flawed, but not intentionally horrendous. However, increasing numbers of scholarly publications have documented how these healthcare systems have become quietly corrupted and call these comfortable beliefs into question. There is universal agreement that prisoners have a right to medical care. Precisely, what is the difference between a prisoner of war and an 8-year-old boy in Sweden being denied medically necessary care? Seizing of the business of a political opposition party is prohibited. Precisely what is the difference between seizing the businesses from a political opposition party and a medical board with members representing one medical society closing down the business of a medical doctor who belongs to a competing medical society? These are all human rights abuses.
That's right, Jenna.
That's right. Testify. Preach.
Precisely what is the difference between a crime of physical assault by policemen against innocent citizens and corrupted governmental policies that assault patient rights to informed consent, diagnosis, and treatment options? Both are acts of brutality by state actors that result in unnecessary physical harm and suffering. Every time a human rights defender, somebody who's trying to help us get some kind of treatment, loses their license, we estimate that 10,000 or more borreliosis patients lose access to proper diagnosis and medical care.
Shame on you.
On October 24th in 2017, that was last year, the United Nations Special Rapporteur on the Right to Health, Dr. Danius Puras, presented his report on corruption to the United Nations General Assembly. He told his audience, quote, "In many countries, health is among the most corrupt sectors. This has significant implications for equality and discrimination and non-discrimination." He noted that domestic and global roots causes of corruption, including those related to pharmaceutical industry and from other institutional corruptions, including insurance sector. He emphasized that the normalization of corruption in healthcare, which includes practices undermining medical ethics, social justice, transparency, and effective provision healthcare, are all occurring across the globe, and these are all illegal acts. These are all driven by profit.
Criminal.
One example of this corruption are the International Diagnostic Codes, ICD codes, that are used globally for Lyme borreliosis, Lyme disease. Normally, ICD codes are formulated in a transparent manner with representatives from almost all the governments and other stakeholders, such as patient groups, caregivers, scientists, medical professionals, and they even bring in pharmaceutical and insurance people. But it's a broad, transparent process whereby the disease is defined and codified, and across the globe it is then used to access medical care. Unlike the other ICD codes, the codes for Lyme borreliosis have not been formulated in a transparent process since the 1990s, early 1990s. And you can imagine that the last time there was any kind of transparency around these ICD codes coincided with the same time period of the deer-borne fraud and the introduction of the Lyme-Rex vaccine. And since then, all the procedure around the formulation of these ICD codes has gone dark.
Same phone. Yeah. Oh, yeah. Switch.
Go, Jenna. Tell it.
My phone is on. I'm like, I need to have somebody else.
So in June 2017, an international group, including American representatives, we met with the Special Rapporteur for Health Human Rights, and the following human rights violations against Lyme borreliosis patients, as well as relapsing fever borreliosis patients, went formally onto UN record. And these are the human rights violations that are on record. The prevention of proper diagnosis and obstruction to access to treatment options that meet the internationally accepted standards. These include the denying of Lyme screening requests made by pregnant women and deny treatment options to pregnant women who have Lyme infection, infections proven to be crossing the placenta, causing severe negative outcomes to babies, including miscarriage, stillbirth, and sudden infant syndrome.
Thank you, Jenna.
They are also promoting discrimination based on the type of manifestation or symptom that you show. There are so many symptoms that are not recognized, so many complications, that if you don't have the few that are listed by the IDSA and the CDC, you are discriminated against. They prevent proper diagnosis and obstruct access to treatment options. They restrict information regarding the availability of treatment options that meet internationally accepted standards. You are not getting your informed consent. They obstruct treatments towards illness manifestations that are not included in the current codes. For example, if you have a Lyme-like neurological complication like a Parkinson'sism, you will not be able to get that diagnosis and adequate treatment for that complication. These codes and these practices and policies support attacks on our human rights defenders, and these include medical practitioners, scientists, and researchers, including the parents of all of us who have kids who are sick. You are all human rights defenders.
Amen.
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 These practices routinely exclude the key stakeholders, such as the medical practitioners, the patients, the caretakers, who are concerned with persistent and complicated cases of Lyme borreliosis. They exclude us from decision-making venues, or they have sham decision-making venues like the current federal tick-borne disease working group. And they make these stakeholders invisible to policymakers, economists, and other practitioners and researchers. They misapply psychosomatic disorder diagnosis and deny care for biological illness in lieu of medical diagnosis and care for biological illness. Sick children receiving treatment that meet internationally accepted standards are forcibly removed from their parents, who are then falsely accused of criminal acts, such as poisoning their children or Munchausen by proxy. And then there are also alarming cases where euthanasia is encouraged over therapies that meet medical criteria.
Medical
And this is
kidnapping.
happening in many, many different countries.
Murder.
The following medical conditions also went onto UN records, and most of them have not been recognized by the CDC or the IDSA. They include congenital Lyme disease, persistent infection, Borrelia, lymphocytoma, granuloma annulare, morphea, localized scleroderma, lichen sclerosis and atropicus, Lyme meningitis, Lyme nephritis, Lyme hepatitis, Lyme myositis, Lyme aortic aneurysm, coronary artery aneurysm, late Lyme endocarditis, Lyme carditis, late Lyme neuritis or neuropathy, meningovascular borreliosis and neuroborreliosis with cerebral anthrax, intracranial aneurysm, Lyme Parkinsonianism, late Lyme meningoencephalitis or meningominoencephalitis, atrophic form of Lyme meningoencephalitis with dementia, subacute presenile dementia, neuropsychiatric complications and manifestations, late Lyme disease of the liver and other viscera, late Lyme disease of kidney and ureter, late Lyme disease of bronchus and lung, seronegative and latent Lyme disease unspecified. These are all on record now.
Thank you, Jenna. Thank you.
Thank you.
And this summer, there are going to be more violations and more health complications going into UN records. Woo! So what is the right to health when we talk about that? When we talk about human rights and the right to health? The right to health, like all human rights, imposes upon the state, meaning the government, 3 types of obligations. Respect. This means simply not to interfere with the enjoyment of your right to health. That means they should not be obstructing your right to care. They should not be interfering that. That is a basic right to health. Protection. The government is supposed to offer protection. This means ensuring that third parties and non-state actors do not infringe upon your enjoyment to the right to health. That means the IDSA has no right, no human right. It's a violation of our human rights for them to obstruct our access to care and to limit the types of treatments that we get. Fulfill. This means that they must take positive steps to support our right to health.
Help her out.
It is heavy.
Look at our little Lyme warriors.
What does it mean when the government has to fulfill and support our right to health? It means that the government must address the health concerns of the whole population. This must be done on a participatory and transparent process.
Transparent!
Where's Dr.
Anywhere? Tick-borne disease working group, are you listening? It must have measurable indicators and results. In other words, they can't just say we're going to help you. They're going to say exactly how they're going to help you.
Yes.
That's right.
And it should be monitored in a way that can be, the progress should be monitored, and there should be, and this is part of the human rights, it's very important, particular attention to all vulnerable and marginalized groups. And in this context, it is important to distinguish the inability of government to do something from the unwillingness of the government to comply with its right to health obligations.
Yes.
And we have a government that is unwilling.
Yes.
So human dignity is the basis of fundamental human rights. It is inviolable, and it must be protected and respected. The dignity of a person is a fundamental right in and of itself and constitutes the basis of all human rights.
Amen, Jenna. Get him.
And it is codified in international law and in our Constitution.
Amen. Yes.
The situation of Lyme and relapsing fever borreliosis patients and their defenders show violations in the 11 human rights treaties. The violated human rights of Lyme patients include the right to liberty and security of person, the right to confidentiality and privacy, meaning your records, the right to information, meaning informed consent, the right to bodily integrity, the right to life.
That's right. That's
The right to life.
Tell it, Jenna.
The right to the highest attainable standard of life and health. The right to freedom from torture and cruel, inhumane, and degrading treatment. So many of us have experienced when we go in to the regular medical exam, treated without respect, we are humiliated, and we are treated in a very degrading and disrespectful and sometimes a torturous manner. Withholding care, medical care, is a form of torture. That is undeniable. Discrimination. The right to participation in public policy, like the current sham of the Tick-Borne Disease Working Group.
Boo.
The right to non-discrimination and equality, and the right to a remedy. Meaning, if something bad happens to you, your legal system should support your ability to right a wrong. The human rights violated of our human rights defenders include also the right to freedom from torture and cruel, inhumane, and degrading treatment, the right to decent work conditions, the right to freedom of association, the right to participate in public policy, the right to due process when their licenses are removed. They have a right to process. They do not have currently, they do not have an unfair and unbiased system, and a right to remedy.
Yes.
I'm almost finished.
That was awesome, though. So far, it's great.
Can somebody squeeze the button for her?
So I'm going to just read to you the names of the 11 international and regional treaties that are being violated every day for those of us suffering from Lyme and relapsing fever, borreliosis, and co-infections. The number one is Convention Against Torture. And then the European Convention for the Prevention of Torture and Inhumane or Degrading Treatment or Punishment. Because, you know, this is a global epidemic. It's a pandemic. The Convention on the Elimination of All Forms of Discrimination Against Women. Women face particular forms of discrimination, as well as women who are pregnant and can't get tested or won't be treated for their unborn children. The Convention on the Rights of the Child. Our children's rights are being discriminated against. Convention on the Rights of Persons with Disabilities. People who are disabled by this disease are not provided the support that they would give to any other patient group that's disabled.
Right.
The African Charter on Human and People's Rights. The European Convention on the Protection of Human Rights and Fundamental Freedoms, meaning freedom to access health care. The European Social Charter. The International Convention on Civil and Political Rights. The International Convention on Economic, Social, and Cultural Rights, Article 12, to reduce infant mortality and ensure the healthy development of the child, to improve environmental hygiene, prevent, treat, and control epidemic, endemic, occupational, and other diseases, create conditions to ensure access to health care for all. The International Convention on the Elimination of All Forms of Racial Discrimination. The right to liberty and security of the person has been held to prohibit unauthorized disclosure of personal health data. Do you know that there are legislations across many different states where they feel that they should be able to access your data online without, every time a doctor, they try to take the license away from a doctor, they go into that doctor's office and seizes all of your medical records, and it is widely disseminated and used without your permission.
Illegal.
That's right.
The rights of bodily integrity and the security of the person have been held to prohibit the administration of medicine to a child against parents' wishes.
Vaccine.
Parental rights in the care of a child are routinely violated. And not only prohibiting the administration of medicine, but withholding medicine to children.
That's right.
The right to freedom from cruel, inhumane, or degrading treatment or punishment has been held to oblige governments to secure the adequate health and well-being of prisoners. And you can imagine how many prisoners also are going without any diagnosis in care. Just a page and a half now.
We love you, Jenna. Keep it up. Everybody's commenting. More.
So, before I get into this last part, I just want to say that these reports that I'm putting into record on the United Nations are considered official documents, and the first one now is already being used in the law case against the IDSA out of Texas.
Woo! Go, Jenna!
So it's very important to actually document this and put it into official record, because it can be used in lawsuits, and it can be used when you're trying to defend yourself to your insurance company. But people need to know about it. They need to be able to access it, and they need to understand how it can be used. But just think of it as kind of like a critical document that no one can dispute, because it's on record in the United Nations system. They might say things to you, but like, no, I have this document that says that this particular manifestation of Lyme actually exists, and it's on record.
Thank you, Jenna.
Thank you.
So, this is the beginning of the end. It is the end of 40 years of gross human rights abuse against persons living with Lyme and relapsing fever, borreliosis, and other co-infections from tick-borne diseases.
End it.
It is the end of state actors promoting policies that obstruct access to treatment options that meet internationally accepted standards, obstruct access to antimicrobials for systemic infections in the brain and nervous system, encourage the misapplication of fraudulent psychosomatic terms, deny access to treatment options, and to force ingestion of psychotropic drugs. It is the end of financial status determining your access to care, and persons becoming disabled because they are denied access to generic medicines. It is the end of sick children under treatment being forcibly removed from their parents, and their parents being falsely accused of crimes, including Munchausen by proxy, when they are the human rights defenders of their children.
That's right.
It is the end of policies and practices that encourage euthanasia and disability over the use of treatments such as generic antibiotics and other generic drugs that have shown to restore the well-being and independence of many thousands. Not all, but they should be accessible to all of us.
That's right.
It is the end of attacks on the human rights defenders of this group. The defenders encompass all medical practitioners, scientific researchers dedicated, I'm talking about the ones who are truly dedicated, to ensuring this patient group will enjoy the highest attainable standard of physical and mental health. It is the end of state actors giving resources to entities and individuals that attack, smear, defame, or stigmatize these human rights defenders or these patient groups.
Woo! Woo!
Why are these people getting money? The U.S. government, NIH, has provided over $32 million in support grants to write articles that stigmatize us. How is this possible? It is the end of laws that encourage corruption and drive these abuses. It is the end of government institutions and officials responsible for promoting scientific and medical innovations being patent holders in the same arenas of competition. And state actors and practices that impoverish patients while enriching private insurers, private medical and scientific investors, and private individuals.
Get him, Jenna.
Criminals. It is also the beginning. All those concerned with public health, access to health care, scientific advancement that serve the common good, social justice, and human dignity need to fully understand this situation. It is big, it is complex, it is global corruption. These human rights abuses experienced by this patient group and their human rights defenders have been institutionalized over a span of 4 decades and encompass all actors found in modern medicine and public health systems. These abuses are not limited to persons living with Lyme and relapsing fever, borreliosis, and other co-infections. They are actually encompassing more patient groups every day. In other words, what's happening to us is being implemented against other patient groups because it's all about greed and profit. These abuses represent trending practices and policies, and they flourish in systems with weakening accountability and weakening transparency.
Transparency.
They are driven by insatiable greed and a lack of empathy. They are boldly corrupting our public institutions, our elected officials, and our intergovernmental bodies. Thank you.
Thank you, Jenna. We love you, Jenna. Good job.